Advin Health Care presents Dialysis Catheter Connection Disconnection, set for aseptic catheter handling procedures. Verify that the package is intact and ensure the sterile barrier has not been compromised. Open the package using standard aseptic technique and carefully remove the contents. Inspect all components and confirm that the required items are present and undamaged. Unfold the sterile drape carefully to maintain the sterile field. Arrange the drape properly and prepare the workspace for the procedure. Inspect the gauze and absorbent materials before use. Ensure all consumables are clean, sterile, and ready for the connection or disconnection procedure. Inspect the syringes and verify proper integrity before use. Confirm that all components are functioning properly and free from visible defects. Prepare the complete procedure tray according to institutional protocol. Arrange the connection and disconnection components within the sterile field. Organize the accessories to allow convenient and aseptic access during the procedure. Ensure that the sterile field remains intact throughout preparation. Place all required items in the intended sequence for efficient workflow. Prepare the remaining consumables according to standard dialysis catheter protocol. Inspect the protective gloves before donning and confirm proper integrity. The dialysis catheter connection disconnection set is now prepared and ready for use. Advin Health Care, delivering quality, safety, and confidence in dialysis care. Advin Health Care, delivering trusted dialysis solutions worldwide.